Good morning. My name is Andrea Sheely, and we are in week 6. We're going to be working on part D. We're going to answer a few questions about a video on Peyton that we watched. So the first question reads, what are developmental milestones for a child this age? So Peyton is 2 years old. At 2, most children are able to use 2 to 3 word phrases, and a few of them like want cookie or please, give me more, that sort of thing. They're also able to improve their motor skills by kicking a ball and then climbing off and on furniture. 2-year-old children are able to copy others. For example, if the therapist says, watch me, the typical 2-year-old child would then be able to attempt what the therapist did. They also build towers of 4 or more blocks. They are able to throw a ball overhead. And then finally, they are able to start to make straight lines, horizontal and vertical, and then making that circular motion when they're using markers or crayons. So question number 2 reads, what are some considerations when completing an annual assessment for a child you do not treat regularly? So I would say, if possible, if there is a therapist who treats that child regularly, making sure you're in contact with them, communicating what is the child's typical behavior, what are their performance like when they are working with the child, just making sure that this isn't like a fluke, a one-time thing because you're not the typical therapist for this child and they're not used to your behavior or how you interact with them. We want to make sure we're giving the child the benefit of the doubt. So talking to the other practitioner if possible. Sometimes it's a coda, which is really awesome, and then other times the practitioner may have left the practice, and so you're not able to get a hold of them. So then the next thing you could also do is working with mom on what the child's typical behavior is, because mom has that regular insight of not only what is the child's behavior in the therapy room or clinic practice, but what is she doing at home? Is she talking to mom more than she's talking to you as the therapist who's seen her one time? Is she doing what mom asks, copying, those sort of things? We want to see what the child's typical behavior is. So the more contact we can get with mom or the practitioner who does see Peyton regularly. And the final question reads, discuss strategies for communication with a child who has speech and language delays. So the first thing is we're going to keep our language very simple. So if you want a child to do something, you demonstrate and then you say you do. Making sure that we're not trying to give so many directions that the child doesn't understand or becomes bored or agitated with what's going on. So you do is just a simple watch me, you do, watch me, you do. If they are having behavior and we want them to perform a specific task, for instance, color, we could say color first, then ball. Color first, then ball. That way they get that this is what we're going to do now, but later we can do the ball without so many words. Another option would be to use pictures. If the child has a regular communication board that they're familiar with, that would be a great option, or introducing a communication board. That way we know what the child is wanting and needing. They're able to point to they want a snack, or they're able to point to they need to use the restroom. And then the final option would be to rely on mom. Mom's not always in the clinic. Sometimes things happen where we ask mom to step out, or mom has to drop the child off, and then dad's going to pick the child up. So this might not always be available, but mom is with the child a lot more than the practitioner is, and so a lot of times the parents are able to pick up on language that other people who aren't with the child as frequently. So for example, if a child is saying key and the mom actually knows that key means I want a cookie, just things like that. So relying on mom to help us transfer the communication, but we definitely want to establish a way the child is able to communicate themselves. That way when they go to school or they're in a situation where mom's not available, we can have good regular communication with them. Thank you. I hope you have a great week.